You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about straight teeth. We're talking about orthodontics today with an orthodontist, Dr. Lauson, who says he's tired of, and I want to get this right, of what's being done in traditional orthodontics. So it's what you need to know. Very interesting topic, by the way. Dr. Lauson, welcome to the program.
Thank you very much, Randy.
All right, good, and we have a lot to talk about today, and we've met only over the phone, but some good stuff. Now, before we get into today's topic, tell us a little bit about your practice. Who's your typical patient?
Well, a typical patient might be a 7-year-old or 8-year-old that comes in just for traditional, maybe preventive orthodontics. And on that patient, we may look at a lot of things like, are they breathing properly through their nose? Do they have things like overbites? Do they have narrow jaws? A lot of different things that we look at that age.
So the parents of youngsters, 7, 8, 9, 10 years old, need to know, according to you, that not all orthodontics are being done the same way. That means
correct.
There's a difference in philosophies.
That's right.
Some, and I don't want to put too many words here, but some orthodontists will pull teeth to straighten teeth, and some don't. And you don't like to.
Well, I don't like to for a lot of reasons, but number one, it isn't necessary, and I'm sure we'll get into that.
Okay. So you treat adults as well?
Absolutely.
And teens. Teen Invisalign?
Yes.
Is a hot one?
It really is. Invisalign is just really taking off the last few years. In a study that was shown that 85% of all teenagers would rather leave crooked teeth than have them straightened with braces.
So these kids, if they go in early enough, the parents that are watching this, your kids could have high school years, for the most part, without braces.
That's one of our main objectives, yes. We'd like to be finished with braces by around age 12, which gives them plenty of time before their high school years.
Okay, now why is it, at the top of the show I said, and I quoted you from our pre-production, you said, I'm tired of what's being done in traditional orthodontics.
Well,
elaborate on that.
Yeah, certainly. People that come in with absolutely fabulous smiles have no need for an orthodontist, so we don't see those. But in almost all people that come in for orthodontics because of crooked teeth or overbites, which are the two main reasons people come in, the problem is a narrow upper jaw. Now, how that is handled makes a profound difference in terms of their overall treatment results.
So crowded upper teeth, though, teeth, normally you're pulling teeth on the upper and lower to narrow.
A lot of times when people come into a typical traditional orthodontist, they will then have crowding, maybe overbites, and that may be cause for pulling of some permanent teeth. Well, I don't like the idea of pulling permanent teeth, never really have, in the 25 years that I've been doing this type of treatment.
Okay.
And we found ways that we don't have to pull permanent teeth. In fact, we changed the bone structure to accommodate the entire amount of teeth.
And it makes a big difference in the smile. If we could start with that photo, and I want to go into your background and training as well. But
certainly.
So we know what we're talking about here.
Yeah, if we look at this young man, he's I think about 16 years old at this time. I want you to notice something on this child. He has got spaces back here between the teeth and his cheeks. And those
so dark holes on both sides of his mouth.
Dark triangles in aesthetic dentistry, or dark buccal corridors, because these are areas that if a person has a very full smile, those don't appear dark. If we just straighten his teeth, then what happens is that those dark corridors remain, the teeth are straight and in alignment, but we have a narrow jaw structure.
So normally if you go to an orthodontist, they would remove what I'm looking at. Let me see with your finger there.
Typically, they would remove 4 teeth.
So which ones would they remove?
Well, they would remove 4 teeth, 1 on each side, here, and then on the upper as well.
Just to make more room?
To make room enough so that they can straighten out the remaining teeth.
So why is that a mistake? That means how are you able to accomplish the same thing if there's not enough room?
Well, there's not enough room because the bone structure is too small.
Okay.
When the bone structure is too small, keep in mind, crowded teeth have really one reason, and that's that the bone mismatches with the size of the teeth. So if the problem is that the teeth are too large, then we might want to consider removing some teeth. But if the problem is that the bone structure is too small, then we have to attack the bone, and we know how to do that. We can widen the bone structure, we can make it more adequate so that it can contain all of the permanent teeth.
So with him, what did you do?
So with him, what we did is we widened his whole upper arch for him, and you can see the result in this picture. And it gives him a real full smile. And notice how those buccal corridors,
The edges of his mouth.
edges of his mouth, notice how those are now filled in with teeth. So we do have a situation where the smile is very full, kind of like a Julia Roberts or another movie star.
Big, broad smile.
Big, broad smile.
Very interesting. So typically, so I get this straight, orthodontics, crowded teeth, they remove 2 on the upper, 2 on the lower to make more room.
Yes.
And then they have 6 great front teeth
Yes.
and black holes on both sides of the mouth.
That's correct.
At least in this guy's case.
That's correct. Yes.
Interesting.
Yes.
Okay, let's talk about your background and training, by the way, because it's very interesting. You said, Randy, I've spent probably about 5,000 hours. You said you started investigating
Yes.
the TMJ joint.
Yes.
Let's talk a little bit about your training.
Yes. Well, my training was pretty much traditional, as basically everybody is in orthodontic school. Probably 95% of the orthodontic schools are teaching methods which emphasize the use of braces.
Okay.
Now, that's fine as far as it goes. But beyond that, there's appliances that were created in Europe a number of years ago called Dentofacial orthopedics. Those dentofacial orthopedic appliances really are the key to this whole thing, because it literally, if you think of it, just stretches the bone structure, make it more full. Then that's the answer in terms of how that is done. Braces cannot do that. So that if you have braces, you're very limited. It's kind of like a golfer that only has maybe some irons, and that's it.
So you're using braces and these what?
And dentofacial orthopedic appliances. So we eliminate the need for removal of permanent teeth in
And that happens
almost
really?
all cases.
Is that happening a lot, where they remove teeth when they shouldn't remove teeth?
Well, it's a question partly of philosophy, and it's also a question of whether they have the proper types of orthodontic treatment appliances.
And one of the things you told me, you say, okay, so if you remove those 4 teeth, you're setting them up for maybe some problems when they're older.
That's correct.
Like teeth shifting.
That's correct.
How? Why is that happening?
Well, first of all, the tongue is a factor. If there's not room enough for the tongue, then the tongue wants to push out. And as you get the tongue into a smaller and more confined space, then that can be a factor. Other things could happen. As the upper jaw, if it's too narrow, a lot of times it's underdeveloped in 3 dimensions, basically. And that dimension, one of them is the forward positioning. So if you take out some teeth, the upper teeth will be brought back. And that could cause problems with profile and overall lip posture, those relationships. It also causes a trapping of the lower jaw, where it causes it to literally go into a more retruded position. That whole combination of things, upper teeth going back, lower teeth coming back, lower jaw coming back, can cause jaw joint problems. Believe it or not, it can even cause head posture problems.
Really?
So the relationship of the teeth to head posture is affected.
Now, this is a little bit off track here, but you treat people for TMJ
Yes.
as well. I mean, you've had NFL football players, you say,
Yes.
that with migraine headaches, they go to you because they know that you understand the bite, or at least
correct.
that's your reputation.
That's correct.
You say you're changing people's lives with orthodontics.
Absolutely. I'll give you an example. This is a particular lady that had extreme crowding. You show this to any orthodontist or dentist, they're going to say, you've got to remove some permanent teeth. She was in her 40s when she started treatment with us. So this is an adult patient. And yet we go from this picture to a wide, full arch form, and you can see her smile picture.
Interesting.
And it's a dramatic change, and I've shown this to a number of orthodontists, and they say, that can't be done without surgery, because if we look at her upper arch here, you can see how narrow it is. The problem isn't that she's, again, got too many teeth. The problem is that she's lacking bone support or bone structure for those teeth. So we widen and we create through dentofacial orthopedic means on this adult patients. Now, Randy, it's important to understand that many orthodontists and dentists don't believe that you can widen upper jaws like this on an adult. This is a real key. It's called the mid-palatal suture. And that mid-palatal suture is the key to this whole thing. We were taught in dental school that the mid-palatal suture fuses at around age 12 to 14. And nothing could be further from the truth.
Really?
Actually, the sutures that are involved in not only the mid-palate, but all throughout the whole skull are living, breathing membranes. They're sutures that exist, and that's a connection between two hard bones. It's just a very pliable material.
So you can move
called
it
a
out.
suture. So basically, we can alter that at any time throughout life. So I have seen patients into their 70s where we have done this widening.
Very interesting, very interesting. Now you have 9 keys to facial harmony. What is that?
Yes. Well, it's part of a new book that I've got that I'm developing, and it'll be out in the next few months.
Straight Talk About Crooked Teeth.
Exactly.
That's the name of it. Who's going to read that book, by the way?
Well,
I say that respectfully, but
yes.
Who's it for?
Well, it really is for the parent of a child that would be young enough to consider orthodontic treatment. And we call it the 9 keys to lower facial harmony because there are actually 9 keys that we look for to accomplish as a result. I'll just give you an example.
Okay, let's hear these.
The first one is a wide and full maxilla. Now, we've already talked about, and the maxilla is the upper jaw, by the way. We've already talked about that widening process of how we've done that on several patients to avoid extractions. But what we want really is a wide and full, ideally shaped maxilla. Now, that's a bunch of...
That's so that way the teeth will go all the way across, nice broad
They go all the way
smile.
across, and it's more than just aesthetics because it affects our breathing through our nose. See, that same bone that's at the roof of the mouth is the same bone that's at the floor of the nasal passageway. And when you think about it, if a person has a constricted upper jaw, they're going to have a constricted nasal passageway as well. So we try to get that corrected as well. Number 2 on the list is actually the ability to breathe through the nose correctly. Yes.
All right.
And then we go into number 3, the lower jaw being in a proper position. Again, if we widen that upper jaw and we encourage the movement of that lower jaw into an ideal position, then you can achieve proper facial balance.
You know, when most people think, and I'm cutting in, we're talking about new breakthroughs in orthodontics. We're here with Dr. Lauson, and he says he's frustrated about what's being done in traditional orthodontics, and that the parents need to know, if you're going to do it, or if you're an adult, that not everybody's doing it the same way, and if you do it a certain way, you may create future problems.
Yes.
Is that right?
That's correct.
Very interesting, very interesting. Now, you brought that skull.
Yes.
What were you going to show us with that?
Well, the skull really shows the relationship, and if you can see the lower jaw and it's mobile. By the way, the lower jaw operates as much as 100,000 times in a day.
Oh, really?
And just 2,000 times swallowing alone, where there's some movement out of that jaw. So it's the most complex joint in the human body, and it's also the most active joint in the human body. So with that, there's a lot of ways that it can go wrong. But the way it can go wrong is if the teeth don't fit together right. And if they don't
So as an orthodontist, it is your role to make sure it's right.
That is part of the orthodontist role, for sure.
Okay.
Yes.
Okay. And that's the part that you're frustrated about.
Well, that's part of it, yes.
Okay, okay.
Because there's very little training in orthodontic school about how to treat these TMJ dysfunctions. And worse yet, there's no training in how to handle them if, in fact, this person gets into a problem while they're undergoing orthodontic treatment, which in many cases is certainly possible. There's a huge amount of nerves that go through the jaw joint, to the eyes, the ears, and to the brain even, and blood vessels as well. This could cause a great deal of stress within these areas if it's not operating properly.
Okay, so look for an orthodontist that has this type of training. And what do you ask them?
Do you actually treat these types of disorders?
Okay.
So it helps to have experience, number one. This isn't learned overnight, but it is a very important thing.
Now, backing up, and I interrupted you because, and if you're just tuning in, we're talking about what you need to know about orthodontics, adult orthodontics, teen orthodontics, and if you have 8-year-olds. Dr. Lauson says that pick an orthodontist maybe that is not just removing teeth as a first protocol for crowding, that there's a huge difference in philosophy in the world of orthodontics. Is that correct?
Yeah, there is.
Okay. So you said there's 9 keys to facial harmony,
Yes.
and I interrupted
9
you,
keys
so what are they?
to lower facial harmony. And the fourth one, we talked about TMJ, making sure that's in proper alignment. The fifth one would be a relationship to head posture, and that's because teeth can influence head posture.
Really?
Yes. And we know that chiropractors and other people that work with neck misalignments get very frustrated doing adjustments on people's
How?
teeth.
I mean, how do the teeth have anything to do with neck posture?
Well, because of the teeth are in a particular position, it forces the jaw, the lower jaw, out of alignment, can cause jaw joint problems, but it also forces the head into a forward head posture.
Go forward a little bit.
Yeah.
So if somebody has a big overbite, they may...
That's right. They may be
that right?
prone to having problems with their posture later on.
Interesting.
Mm-hmm.
And okay, so other keys.
Another one would be just facial symmetry, and where a jaw goes off to one side or the other. Now, this is something that's recognized by virtually all orthodontists, that they want to get that symmetry corrected, and many of them use surgery for that. Sometimes that can be a mistake because the jaw could be out of alignment, and the jaw can shift over to one side, creating a jaw joint problem. And so,
do they call that a crossbite, by the way?
They do, yes.
And you're saying surgically is how they normally take care of it?
Well,
oftentimes?
It might be. And I don't want to infer that every orthodontist is following these protocols. They're not. There is more and more enlightenment that's taking place on this.
Good.
For sure. But one of the mistakes that I've seen over the years is that there might be surgery on a jaw because it appears to be a lack of length on that jaw, and they'll move the jaw around surgically, but in fact, the problem was within the jaw joint itself. So it created a jaw joint problem that was precipitated and perpetuated.
And you could do these with these orthotics, or what are you calling them?
Yes, that's correct, an orthotic to move and it's not a orthotic in your feet, but it's one in your mouth, and it's a special type of
You sleep with them?
Sleep with them, we wear them 24 hours a day.
Okay, good.
And it can reposition the jaw into an ideal position. So if a person has jaw joint problem, that is typically what we do first before straightening the teeth.
We're going to take a quick break. We come back, more about, when should a parent bring their child in for orthodontics? You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about new breakthroughs in orthodontics. With us, we have Dr. Lauson, and he is well known in Colorado for his work with TMJ and giving beautiful smiles with orthodontics. Okay, so we've talked about teen Invisalign is something you do, and you're straightening teeth without removing teeth.
Yes.
In most cases.
Yes.
Okay, so how young, to parents watching this, what age should they bring in their kids?
Well, typically we want to see a child by about age 7. Okay?
Really?
And that's recommended by the American Association of Orthodontists as a guideline too. That's because a lot of the front teeth are starting to come in at that time, and we need to know if there's crowding.
So, and I have a 9-year-old.
Uh-huh.
And so when all of the teeth are finally, all the adult teeth are in, is that when they should come in, or even before? And what's the advantage of going before all the teeth have fallen out?
Going before at around age 7 is ideal because we can assess things like overall facial harmony, overall breathing. We look at things like tonsils and adenoids to make sure that they're not obstructive. We make sure that the tongue posture is correct. We make sure that the arch forms are wide enough so that we can put, all the permanent teeth can come in to the correct position. We look at things like overbites, and we may start treatment somewhere around age 7 to 8 if those are an issue.
Okay, so we're just about out of time. One more photo, because I know you have a stack there. What are we looking at?
Randy, this is a real unusual type of situation here with a complete crossbite on all of the teeth. And the problem is that her upper jaw is very narrow, and so we show that the upper teeth go inside the lower.
So it's like an underbite.
This is an underbite,
okay.
Yes. And that typically might be handled by a surgery when a person is maybe age 16 or so. Well, we do it completely differently. We do the orthopedic changing of this bone structure so that it can accommodate all the teeth. And you can see the difference between the size and shape of these two pictures, okay?
Very interesting.
So we create that nice, full, beautiful smile, and then we do that, I think this is maybe 20 to 22 months after we started treatment with this child, and you can see the nice, beautiful result we get.
So we should mention, because that's one of the reasons why you wanted to come on the program, that a case like that will, especially parents watching this, that underbite.
Yes.
Rather than going to surgery, You use these European, I'm calling them European orthotics.
That's where they created.
Okay.
Yeah.
With a combination of braces.
Yes.
To avoid surgery.
Yes.
And get better results.
Exactly. Yes.
Okay, interesting.
Yes. I'll tell you a brief story about somebody with exactly the same position that I saw when she was age 12. She was told she was going to have surgery at about age 16.
For the underbite.
For the underbite.
Okay.
We treated her, and I saw her just about 2 months ago as a 31-year-old patient. I was doing some research on my book. 31-year-old patient, she came in, her teeth looked beautiful, no relapse whatsoever. So.
Interesting. Okay, so we're here with the author of Straight Talk About Crooked Teeth. Now, we're trying to make this a very positive show, by the way, okay? But the truth of the matter is, the more I talk to you, the more we've talked offline, that the reason you're writing this book, and I don't want to put words in your mouth here, is because philosophies differ in the world of orthodontics, and you think there's some harm that's possibly being done with the older techniques. Is that true?
That is true.
You're setting these kids up for future problems like TMJ and things like that, but can you prove any of that?
Well, I see even today approximately one patient every month that was previously treated by orthodontics that has TMJ dysfunction. In fact, I had a transfer case. The orthodontist was ready to remove the braces, and the mother, who I happened to meet in a social engagement, started talking about this. And all of a sudden, she's got her daughter over to evaluate, and I said, no way this child should have their braces removed, because they have some substantial TMJ dysfunction going on.
How do you know that, though, from a conversation with the mother?
Well, she told me that the child had clicking and popping and headaches and pain within her face and that type of thing. And yet the orthodontist was talking about removing the braces at this point without correcting that problem.
So we're out of time. Okay, so I want to do a recap. That your main message here then is that orthodontics is more than just straightening teeth. Is that right?
Correct.
Okay.
Yes.
And that if you're going to choose your orthodontist carefully, one that is in this new paradigm, this new philosophy of not just removing teeth, but widening the upper arch.
Yes.
Is that the future of orthodontics, in your opinion?
Well, I do think that it's headed that way, and hopefully sooner rather than later. But the concern is that it's not moving along as fast as it could. But I do honestly feel that most orthodontists are really yearning for this type of philosophy, and they just need additional training, and they're coming around.
Because parents obviously want to do the right thing. They want to send their kids in to straighten their teeth.
Absolutely.
But you're saying that there's more than that. That you have to be a little bit aware.
Yes.
And cautious.
Yes.
But we don't even know the questions to ask. So what do you ask? I asked that earlier. I still don't know what to ask. I mean, how do you know that your orthodontist has this kind of training?
Well, you have to look for somebody that's gone well beyond what they learned in orthodontic residency. And that includes a number of things that we're talking about. Do they do treatment with dentofacial orthopedics? Do they understand the importance of the jaw joints? All of these types of things.
So dental orthopedics are the key to this whole thing?
That's
so you couldn't do what you're doing without these orthopedics?
I could not do what I'm doing without dentofacial orthopedics, for
How
sure.
many, I don't know, give me a basic statistics, nationwide orthodontics that are using these European orthotics.
I'm almost sorry you asked that question because because it's not a great number of them that are using them effectively.
Like less than 1 or 2%?
Oh, I'd say, I don't want to put a percent on it exactly, but a small percent are using them really effectively.
Less than half? Less than half, though, are even
Far
using them?
less than half, yes.
Okay.
And some use them to a great, an earlier extent, such as earlier treatment. A lot of them use them up until about age 12, and then they fall back into the surgery after that age.
So you don't like surgery then?
Well,
Can you avoid it more in most cases?
I like it whenever it's absolutely necessary. As an example, a facial asymmetry may require surgery. Okay, and I'm not saying
big overbite, big underbite usually can be taken care of?
Usually they do not require surgery.
Well, thank you for coming on the show. So these photos, these stories are all on your website?
Well, many of them are.
Okay.
Mostly before-after pictures. They don't go into the full stories.
And for people that have had orthodontics and that are hanging around Colorado feeling good, TMJ problems, maybe they're grinding, they have sore jaws, they know they had orthodontics, maybe they should come in for an opinion.
Well, absolutely.
Is that right? An evaluation.
we do offer a complimentary evaluation for patient, including
So if it's
a necessary
clicking,
X-ray.
sore jaw, migraine headache, and sore
Yes.
jaw,
Yes,
you know that, or short teeth, like you say, there's a problem.
that's right.
And it can be fixed.
Yes, almost always things can be fixed.
And you're one of these guys that are kind of a fanatic about ongoing education. In fact, when I talk to you, he goes, you know, I'm going to this Parkinson's seminar in Palm Springs, how the bite may have a relate. Is that right?
Absolutely. There's always things to learn. And I think probably till the end of my life, I'll be wanting to learn as much as I possibly can.
All right, well, thank you for coming to the show. Great stuff. Great
Thank you.
info. Great info.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. Just put in orthodontics or Dr. Lauson. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.